Chronic traumatic encephalopathy, better known as CTE, is a neurodegenerative disease caused by multiple concussions or subconcussive hits to the head. It is most commonly found in athletes, but it is also found in some veterans and victims of domestic violence. In CTE, the abnormal tau protein gradually accumulates and forms small clumps around the tiny blood vessels in the brain, mainly at the depths of cortical folds, where stress on brain tissue is higher. The tau deposits are concentrated in the superficial cortical layers, a key feature that distinguishes CTE from other tau-related diseases. As tau continues to spread, it disrupts normal communication between neurons and interferes with how brain cells maintain their structure. The buildup of tau eventually causes neurons to malfunction and die, leading to brain atrophy that can become widespread, involving brain regions responsible for thinking, memory, decision-making, emotions, and movement. Chronic neuroinflammation in CTE is mainly caused by the brain's immune cells, called microglia. Years of repetitive head impact cause these cells to become permanently activated. Instead of helping the brain heal, they cause more damage. They surround the neurons that already have tau buildup and release inflammatory chemicals that damage brain cells and increase the accumulation of abnormal tau, creating a feedback loop where inflammation causes more tau, and more tau causes more inflammation. This causes CTE to get worse even after the person stops playing sports. Meaning CTE is not just caused by the hits but also the brain's immune response. The frontal cortex is the first area to be affected and the most affected by CTE, followed by the temporal lobe, amygdala, parietal cortex, hippocampus, subcortical nuclei, and brainstem. Symptoms normally appear after years of repeated head impact and slowly worsen over time. In stage 1, when damage begins in the frontal cortex, personality changes, poor judgment, aggression, and impulsive behavior may occur. In stage 2, tau spreads into the temporal lobe and the amygdala, which causes memory loss, confusion, difficulty learning new things, as well as mood swings, anxiety, depression, irritability, and emotional instability. In stage 3, as tau extends into the parietal cortex, this causes problems with concentration, focus, and slower processing speed. Tau soon after spreads to the hippocampus, causing impaired long-term memory. In stage 4, the most severe stage, there is a widespread accumulation of tau in the subcortical nuclei and brainstem, leading to difficulties with movement, less motivation, problems with sleep, and emotional dysregulation. In some cases, the depression can become bad enough to lead to suicide because of the changes in the brain. This is why individuals with history of head impacts should seek mental health support if they are feeling depressive or suicidal thoughts. CTE cannot be diagnosed until after death. This is because diagnosis requires the detection of specific patterns of tau buildup, which are impossible to see with regular brain scans. CTE cannot currently be diagnosed with brain imaging tools such as MRI and PET scans because they cannot distinguish CTE from other tau-related diseases, such as Alzheimer's. There is currently no cure for CTE, and no treatment that can stop or reverse the buildup of tau in different brain regions, but there are therapies to manage the symptoms. Antidepressants such as SSRIs are used to treat the depression and anxiety caused by CTE. Medications such as donepezil, rivastigmine, and memantine are essentially borrowed from Alzheimer's treatment, helping with memory and thinking problems. In more severe cases, they use a lower-risk antipsychotic such as quetiapine. For movement symptoms, doctors may prescribe Parkinson's medications such as levodopa. Alongside medication therapies, such as cognitive rehabilitation, physical therapy, counseling, and family support, are very important to help individuals cope with the daily challenges that come with CTE. Though none of these treatments are a cure for CTE or are directly created for CTE, they can really help with managing symptoms. Although CTE cannot be diagnosed in living right now, we know that repeated head impact is the main risk. This means that one of the main focuses when it comes to CTE is prevention and awareness. Making sure the athletes know the risk and take early symptoms seriously, as well as preventing injuries by improving safety precautions in sports. This could be by using more protective equipment, not playing if symptoms occur, and adjusting the rules so fewer hits occur. Preventing injuries is the best way to protect athletes until a cure is found. We do not have a cure for CTE yet, but we can reduce the risk, support those affected, and continue to research.